Oh, good morning, everybody. You know, this is being of a rehab psychology background and then being asked to speak at the Actuarial Institute seminar was a bit of a mind crack for me because I don't know much about numbers, but I do know how people feel about them when they're bad. So it's a very strange situation. But I've been asked to talk about recovery at work. So my background is in rehab and having spent many, many years looking at these various schemes. And you know, naturally, if we can get people back to work very quickly, we are going to be able to save money, which is a very good thing. Do you know, though, as a stakeholder in the system, so if you're a rehab provider, you're a physiotherapist, you are a doctor, you can at times be working across 11 different scheme rules and up to 32 different service level agreements that are coming out from all the different organisations and employers, which causes a problem. So it's in one respect we're saying let's talk about recovery to work, and on the other side we also need to understand the complexity of the system that we're working in. I have 3 principles of recovery to work. The first one, we need to prevent the need from recovering from an injury in the first place. I didn't know this, but I have since learnt that the cost of unintentional injuries is $753 billion a year. Could you imagine if we were able to reduce that by even a little bit? And interestingly enough, when we're talking about health and well-being, the preventable risk of just obesity and poor health behaviours at the moment is quite enormous. In fact, I get asked to talk about ageing quite a lot, and people will talk about their fear around ageing workforces. And I always think, well, if you are ageing badly and you're not looking after yourself, you're directly influencing that $753 billion a year. The other thing about recovery to work is engagement. Now, it's all very well and good to say, let's get people to recover at work. We will save a bucket loads of money. We lose 1.5 million weeks a year due to injury. Isn't that a big number? Do you know, since the New South Wales legislative changes in 2011, we can all look at the New South Wales scheme and we can say, wow, we reduced all these injuries and we reduced costs, and the Treasury managed fund as a result has increased their sick leave time by 3 hours per person, which is around 1 million extra hours a year in sick leave. So we're just moving the problems from place to place. We have to create workplaces that people want to recover at. If I feel crap about my job, why would I want to go back to it? Which means we have to be even better at thinking about recovery to work. It's at being able to stop the injuries from happening in the first place. And the other thing that I'm discovering more and more is our complete inability to communicate well. We have moved into a space where connection is so poor between people that, on the one hand, if we're talking about recovery to work, we need to have set up pathways of communication in the first place so that people want to be able to talk to people and feel like they're cared for. This is what the scheme should look like. Now, who actually knows the history of workers' comp and case management within the scheme? Let me give you my history lesson. It could be wrong, but I'll give you my history lesson. Person has an accident, goes back to work. Seems very simple. The Disability Services Act, though, in Australia, was designed to help people with a disability they had their disability, a person would help them get back to work, and it should all be very streamlined. We should remove the barriers for that. However, in 1986, when Diana Kenny wrote a paper on the case management system in the Disability Services Act, we then swooped it up into the workers' compensation schemes and we put a case management model into workers' compensation scheme. And as far as I can tell, little research has been done as to the effectiveness of it. And it's great that, and I love what South Australia is doing, but it is a very different contained system compared to all the other craziness that's happening out there. When that paper was written and case management was brought in, it became an untested system, and that meant that the scheme, from a person who has an accident, we all figure out what to do and the person goes back to work. This is what the scheme, when it goes wrong, which it does because cost keeps going up, looks like. It's not to deny that 65% of people will go back to work in 2 weeks, 80% will go back in 13 weeks, although even reducing that by a week would be really good. The schemes are written at the moment to say that the injured worker is the person that has the power. You know when you read it, like the injured worker is like the centre of all things. But in reality, there are so many people around that injured worker, and the more time that you spend within the scheme, it becomes quite chaotic. Now, can you imagine you're going to now overlay that with like one case manager in a scheme with 80 files, and then they have all those different stakeholders, and people's language starts to become quite chaotic as far as return to work. And our schemes keep getting more and more expensive. So who has the power inside a scheme? And so if we're talking about recovering at work, so you're trying to recover at work, you don't like the job that you're going back to, and you have a lot of people who don't know what's going on, it makes it very, very difficult to actually try and get through that quagmire of information to get back to work in the first place. Now, I like to look at things in prevention. This is, you know what, sometimes you can see something that's about to happen that's really bad and you think, I'm just going to wait quietly and see what happens. My husband, we used to own a farm, and my husband was out in the tractor and I said, don't go down to the back field because there's a swamp down there and you will bog the tractor. And he didn't think I knew what I was talking about, and he took the tractor down and he bogged the tractor. We need to think about preventing risk and listening to each other and being able to come at it from a place that does very much look at the well-being of a person before it happens. Recovering at work is not actually going to be as effective as prevention in the first place. The second big thing is engagement. Engaged people injure less and they go back to work faster. So we have to, as a group of people, figure out if we actually want to drive the change in the first place. Do you know that an effective person at work has 143 productive hours a month? And an ineffective person at work has 43 productive hours a month. That's a lot, isn't it? So if you're now creating systems where you can engage people to increase their productivity, you're then going to decrease their risk of having an injury in the first place. There was a friend of mine in Melbourne, and she did a PhD on 6 minutes of stretching before each shift for nurses. And she found that if she brought everybody together and everybody got together and they all started stretching, that they reduced their claims by about 40% over time. They increased engagement. They were able to see a number of incredible outcomes as a result of this 6 minute stretching. However, if I'm stretching now, and I'm talking to everybody, and then I go into work, how effective was the stretching, and was that really what was going on? Or was it that everybody in that team was able to get together for 6 minutes a day and have a good laugh at all the nurses and the doctors, you know, doing their stretches together? The best employer I ever had was at the Commonwealth Rehab Service many years ago, and she insisted we all have morning tea together, which at the time I thought was really ridiculous. But every day for 10 minutes, there were 24 of us in the team, we had to, it was compulsory, sit down and have a cup of tea together. We didn't have to talk about anything, but we had to be together. And we were, without fail, the most effective team I've ever worked in. And I look at where the team members of that space are now, and they're now these incredible leaders that not only used to sit there and chat about cases and doing hair and nails and whatever it was, but they're now still an incredible support network. Oh, in case anyone wondering what that picture is, that's my son and my husband throwing themselves off into the water together. You know, that's just, that's engagement. I think it's a nice picture. That's why it's there. It's just there. Safe Work Australia 2014. I love Safe Work Australia. There are some great things that come out of that. I did some research for them last year, and we talked about the best early intervention programs around, you know, in different companies. One thing that I learnt very quickly, and what do you think? 90% of all workers will get back to work within 3 months if they feel what? Guess. Anything. Sorry? Cared for. Isn't that funny? If you feel cared for, you have a 90% likelihood of returning back to work. If we have 1.5 million weeks of injured workers sitting out there, wouldn't it be amazing if they felt a little bit cared for? If the employer did what they could to support them, gave them information around rights and responsibilities, made an effort to help them find suitable employment, felt the employer had helped them with their recovery and treated them fairly. These are people skills. We are now talking about a scheme that is driven on money, and we are moving into touchy-feely, and it's very, very important. This idea around connection is hugely important. So this is how I think about recovery at work. We must start caring for our workers, and I know we're moving away from numbers, but if we think about that, we can translate to numbers. If you have a healthy worker and they're more productive, you can increase the productivity of your workers by 100 hours, so already you're going to be making money. If healthy people are more engaged, you're going to get better productivity. If you have happy people will go back to work faster, you're going to reduce your 1.5 million hours lost a year. So our schemes need to remove barriers. We have to have clear communication systems, and we have to start working towards the same goal. So if you are a stakeholder within the scheme, just think, you know, it's very confusing to work across all the different schemes all at the same time. Thank you. That is all I have for you. Oh.